This man is getting headache relief, and so is this woman, and this woman, and this man too. They're all receiving help for their migraine and headache pain.
It's really looking at the entire system, but every medical condition somehow affects muscles, and in some cases it's the cause.
Relieving headache pain by treating muscles is the idea of Al Meilus, a therapist who developed and patented this robotic arm and has sold thousands of them across the country. Al programs the robot to lengthen the muscles that can alleviate headache and migraine pain. He likens it to principles of engineering.
It's like the Sunshine Skyway cable. Shorten one cable 3 feet and the whole system is off somewhere. Find that cable, lengthen that cable, you get them the relief. The robot breaks up adhesions and lengthens the muscle.
And relief can be almost immediate.
10-15 minutes, you start to feel it right away.
And it's an immediate relaxation, knocks the headache out within just a few minutes, really.
That quickly?
That quickly.
This may look painful, but it's not. Mark Moore is receiving treatment for sinus headaches brought on by, among other things, too many hours at the computer.
If you can get it, you can actually see there's a lump here. It might be difficult to pick up with the camera. There's a lump here. There's no lump here. That's a bulging muscle.
Learning how to relax the muscles definitely has helped. I have not gone through a box since January of pills, and I rarely take a pain pill now.
Heather early started using the robot for arm pain, and then came headache pain.
And I'm one of the patients that didn't immediately use the robot, started with a headache board and was able to manage my headaches at home by myself, and that was really great for me.
This is the headache board she's talking about, a do-it-yourself remedy that targets the muscle at the back of the neck.
I would say half of my practice is migraine related.
Dr. Diana Pollack is a neurologist in Clearwater. She says the studies so far on physical therapy to treat migraines have not been done in a scientifically rigorous manner, as she put it. Still, she refuses to dismiss what therapy can do.
Oh, certainly not. No, I send people for neuromuscular therapy and atlas orthogonal therapy all the time because it's such a clear trigger for many people with headaches.
The proof is in the patients.
I always said if he can help me, he can help anyone, and he helped me, and so I definitely think that he can help everyone.
Thank you so much for being here this morning. We were talking about the headache board, and boy, this doesn't look like anything that would really do anything, but it actually works.
Yeah, basically all of your nerves have to come out by the base of the skull somewhere, go down through the spine, and come out through the rest of the body. Okay, one of the nice things is going right back here, you're controlling the nerves, some nerves for pain, but you're also controlling the vagus nerve going back there, which is responsible for nausea a lot of time in headaches. And it doesn't look like much, but this is where a little cut out for your vertebrae. Yeah. And you could be doing it like this while you're waiting to go on the air or something like that, and it will take the pressure off.
It doesn't look very comfortable though. But the headache probably is worse.
Yes. Yeah. Anything's worse, better than that.
Okay. All right. Well, we want to get right to it. We want to answer some of the emails that we've been receiving at TampaBase10.com, and when folks found out that you were coming in, we were simply flooded with the emails. So here's the first one. Finder asked something many of us are wondering: how do I actually know I have a migraine, or is it something else, a really bad headache, say?
First of all, if something comes on immediately that you've never experienced before, call 911. But if this is something that you've had for a while, you need to go through different things. My migraines have been triggered by things as simple as the pupil distance in my glasses. Okay.
And do some people see like
those are aura.
Sun split?
Yeah, it's called an aura.
Okay.
You can have migraine with aura, meaning you're seeing any kind of random pattern. You have migraine without aura. There's over 50 classifications of migraines, and they try to narrow them down based on the symptoms, based on MRIs, based on CT scans. And the gentleman that you just showed, Mark, thought he had migraines here.
Yes.
They were coming from here and here, and it was just muscles putting pressure on his sinuses. And in his particular case, that's not a migraine. If you're getting relief from over-the-counter stuff.
Then it's definitely not a migraine.
No, because it's got caffeine, acetaminophen, and ibuprofen in it. And
your answers are great, but we want to get to at least one more email. A viewer named Sarah asks, can this therapy help with any type of migraine?
yes, you must take your medications first, as assigned by your physician, and then treat as fast as possible with that, and get to us as fast as possible. The ones that have them extremely chronic, get one of the small portable units, take care of yourself at home. Everything is self-sufficiency. Take care of yourself.
All right, Al Meilus, thank you so much for joining us live in studio, and hopefully that helps a lot of people out there. And Dave Worth's Extra can be found online.